So picture this. A brand new nation has to build its entire healthcare system, literally from the ground up. Where do you even start? Well, today, we're diving into the incredible story of a single medical college that became the answer to that very question.
I mean, it's a massive question, right? But that was the very real challenge that a newly formed nation was staring right in the face. And the answer, as it turns out, really begins with the founding of just one college.
And that college is Khyber Medical College, or KMC. It's got this nickname, the Mother Institution, and for a really good reason. For decades, if you look at the top doctors and the big healthcare leaders in that entire region, yep, they pretty much all came from here.
So here's our plan. We'll start at the very beginning, right after partition, then we'll trace how it grew into a legacy, take a look at what it's like today, and see how its mission ended up having this huge global impact.
Okay, let's go back in time. The year is 1947. With the creation of Pakistan came a massive problem. There was a critical shortage of doctors, especially up in the rugged northwest frontier province. So the need for a medical school right there, on the ground, it wasn't just a nice-to-have, it was absolutely urgent.
So who stepped up? Well, the challenge was really taken on by two main people. You had Colonel Manowar Khan Afridi. This guy was a world-famous malaria expert, and he had the vision. He teamed up with the province's chief minister, Sardar Abdul Rashid, and the two of them were like, okay, let's do this.
And get this, the college officially opens in 1955, but they were in such a hurry to get started that classes actually began while the main building was still a construction site. I mean, that just tells you everything about their determination.
And that very first class, how big do you think it was? Just 50. 50 students. From that tiny, humble start, a massive legacy was about to unfold.
But what's maybe even more remarkable is who was in that first group. Right from the get-go, 6 of those 50 pioneers were women. That sent a huge message about the college's commitment to inclusive education right from day one.
So, the big question is, how do you go from a class of 50 to a total powerhouse that defines healthcare for a whole region? Well, let's walk through the key moments in its growth.
You see, KMC's journey was anything but static. It was constantly evolving. It started out under the University of Peshawar, then shifted over to the health department. This timeline here shows a really clear path toward independence, which finally happened in 2015, when it got full financial and administrative autonomy. Every single step along the way was a strategic move to better serve its community.
Okay, so fast forward nearly 70 years. After all that growth and change, what does this mother institution actually look like today?
Well, remember that first class of 50? Things have changed a lot. Today, KMC has about 1,500 students enrolled in both its undergraduate and postgraduate programs. What a jump!
And its main teaching hospital, the Khyber Teaching Hospital, it's become this huge, top-tier care center. We're talking over 1,200 beds, and it serves more than 500,000 patients every single year. Just think about that scale.
You know, KMC is so much more than just a college now. It's a major employer with over 700 staff. It's a research hub, publishing 2 of its own academic journals, and it's even ISO certified for quality. It really is a hub of excellence in every sense of the word. But here's where the story gets even bigger. It doesn't just stop at Pakistan's borders. Nope, KMC's impact has literally spread across the globe, all thanks to its dedicated graduates.
And this quote here from Dr. Rashid Hanif, he's the president of the KMC Alumni Association of North America, it just perfectly sums up the pride and the forward-looking spirit of the whole KMC community wherever they are in the world.
And that alumni association he leads, KMCAANA, is a serious force for good. They're providing scholarships for students who need it, helping train hospital staff back in Peshawar. They even helped arrange the medical care for Nobel laureate Malala Yousafzai. This global network is so important because it means KMC grads are recognized and can practice pretty much anywhere. So, after all these decades of expansion, after reaching every corner of the globe, what's really at the core of Khyber Medical College?
You can really see its legacy when you just look at some of its graduates. We're talking about incredibly influential health activists like Sanya Nishtar, the president of the American College of Physicians, pioneering inventors, and even figures who played a role in major world events. It's an incredible list.
And that really brings us to what might be KMC's most profound legacy. For over 70 years, it has been, and it still is, the absolute backbone of the entire healthcare system in its home province. It's just such a powerful example of how one single institution, born out of pure necessity, can become vital to the well-being of millions.
And all of this work, it all boils down to one simple, powerful motto that's been there since day one: service to humanity. That's it. That was the core principle that drove the founders, and it's what still inspires the students walking through its halls today.
So from a building that wasn't even finished to a global network of healers, the story of KMC is all about vision and service. And as it heads into its next chapter, you have to wonder, right? How will this mother institution keep nurturing new generations to go out and heal the world? Something to think about. Thanks for watching.